Thank you everybody for being here. I'm overjoyed to welcome you to our new home. This building at 45 Willard Ave is not just the location for the country's first state-sanctioned overdose prevention center, it is also the home for more than a dozen other services that will keep people healthy, safe, fed, clothed, clean, supported. This building includes our expanded drop-in center, providing case management services, HIV and hepatitis C testing and prevention, basic needs, recovery housing support groups for sex workers, trans and non-binary folks, as well as exciting new services, including medical care, substance use treatment, laundry, and showers. I have the privilege of thanking everyone who has made this day possible, and I want to apologize in advance for missing anyone. Please know that we deeply appreciate your partnership and support, even if you are not specifically named. The thank you list includes not only the dozens of people in this room, but also the countless people in the community who have fought, organized, advocated, built, donated, and knocked on doors to make this happen. This has only been possible because we are part of a powerful community, and we are enormously grateful for every single person who played a role in getting us to this place. We also remember the people who are not here in this room, the people who are no longer with us, whose lives may have been saved if the Overdose Prevention Center had existed and if they had been able to access life-saving services. We cut this ribbon today, and indeed we do everything we do in memory of them. The first group of people that I would like to thank are the legislative partners who fought so hard to pass the bill that authorized the Overdose Prevention Center, which was first law in the country to do so. Senator Josh Miller, Representative Jay Edwards, the sponsor of the bill, who worked hard for so many years to get it passed. Steve Ndoye from the Rhode Island Medical Association organized many of the original meetings to advocate for this legislatively. Our state reps and senators for this district, Rep. Jose Batista and Senator Tiara Mack. Senator Mack even canvassed door to door with us in the January cold when we were gathering resident feedback. Thank you to our federal partners, including Rafael Silva on behalf of Senator Whitehouse and Kate Michaud on behalf of Congressman Gabe Amo, who have been amazing and supportive partners. Thanks to our governor, Dan McKee, for the message he sent to the nation when he proudly signed the authorizing legislation, and for his leadership in Rhode Island's overdose response efforts. The members of the Providence City Council, and particularly Councilwoman Mary Kay Harris and Council President Rachel Miller, who were champions for this effort in this location, sponsoring the resolution that unanimously approved this location. Providence Mayor Brett Smiley and his team at the Health and Human Services Division, who have not only supported our efforts, but also designated city opioid funding for this building. Can we give them a round of applause? We thank the Attorney General's Office, which secured the settlement funding to allow us to open, and to our incredible partners at UHHS, Cathy Schultz, Marty Rosenberg, and Assistant Secretary Anna Novais, who have worked tirelessly on this contract to allow us to operate. Thank you. Thanks to our partners at the Rhode Island Department of Health, including Director Larkin and his whole team, many of whom have been with us since the very beginning, working to make this dream a reality. Thank you to Director LeClaire and your team from BHDDH. A huge thank you to our funding partners, particularly the Rhode Island Foundation, for their stalwart support, and a shout out to our individual donors, including many of you in this room. I would be remiss if I did not tell you that we are still in the middle of our year-end campaign. So if you are inspired to support this work, please go directly out of this door when we are done. And Celia from our development committee will gladly accept donations. To our community partners, our clinical partners Victa, Lisa, and Alex and their team, Michelle at Pony, EMS Chief Zach Kenyon, and so many other partners who make our work easier, more joyful, and bring so much energy and skill, we thank you. to our partners around the world, including the amazing folks at On Point in New York who paved the way for us, and our national thought partners at Drug Policy Alliance, we thank you. Thank you to our remarkable board who have been rock stars through the challenges and celebrations over the past 5 years. Finally, I would like to thank a very special group of people, many of whom have been working 7 days a week and until 1 a.m. on some nights to make this happen. I wish I could call them all by name, but we are now a staff of 40 people, and so that would take a very long time. PWR staff and volunteers, can you please raise your hands or somehow shout out? This is the most hardworking, dedicated, and loving people to ever do this work. I want to do a special thank you, even though I said I wouldn't shout out any of our staff because we have 40. One special thank you to our Director of Operations, Mills. He's probably very angry at me right now for calling him out, but he is the reason that we are sitting in chairs, that we have water in our pipes, that anything exists in this building. It is because of him. And this is a building that people can be proud to visit. This is a building that our clients can be proud to visit. And people can receive a range of services, from medical care to treatment, from food to clothing, and access life-saving supplies. And this is because it physically exists, and every single piece of that we owe in part to Mills' hard work. So thank you, Mills. So thank you once again for being here, and I'm really proud to introduce Assistant Director Anna Novais to inspire us on this momentous occasion.
Thank you very much. I don't know about inspiring, I will try. But it really gives me tremendous, I feel honored to be here today. This is a historic moment, and it's taking so much work and for so many people. You thanked so many. I want to start with you, because truly, Project Weber Renew, your leadership, this will not be possible, so thank you. My recognition to Mayor Brett Smiley. We've known each other from a long time, and we probably work on something related with this from those early days in state government, because it does take a whole of government approach to make this happen. So the thanks go definitely, as Colleen mentioned, to the governor, to the attorney general, to all of the legislators, and we do not do special shout outs, but we do need to Senator Miller, but all of his efforts around drug overdose. He says he never behaves, and he misbehaves well, so we appreciate that. And it's been a pleasure to work around a legislator body that is really creative, innovative, and challenges itself, supporting the work that needs to be done. The people that we serve, the community that we serve, our providers, our partners, all folks that we definitely need to recognize. And my colleagues at the EOHHS, my colleagues in state government, Director Larkin, Director Leclerc, if you two weren't there, supporting, cheering, pushing, challenging us, and being challenged at the same time, none of these will be possible. So thank you for partnering with us and together making this happen. I usually, there's a quote that I like to use. I use it at my advantage many times when I don't do things very well. And the quote is, it's from Maya Angelou. And she says, do the best you can with what you know. And when you know better, do better. So I keep that in mind. And so I try to do better and to know better. And I think we know better by listening to the voices of those that we serve. We know better by listening to the providers, to the community, to the families. And when you listen, you can do better by creating choice, by bringing the services, the policies, the resources that people need when they need them, as they need them. That's one of the things that we've done here. We listened so we could knew better, and we did better by creating choice. When you do that, when you listen, when you create choice, you get to what I like to say, equity. Those three words, listening to the voice, creating choice in the systems, in the resources, in the policies, do get us to equity, to this place that shouldn't be a dream, but to a place where every single one of us, regardless of the circumstances of our birth, regardless of the color of our skin, of the language that we speak, religious beliefs, gender identity, orientation, disability, geographic zip code where you live, regardless of the moment where you are in your journey. You feel heard, you feel seen, you feel supported, and more important, we create the opportunity for every single one of us achieving our potentials. That's when we get to equity. That's when we know better, so we can do better. Today we are doing better. Rhode Island is doing better. We're serving better. We're supporting better. And we are making the rest of our country who's watching us, we are going to make them proud. So thank you for everything.
Next time, please welcome the mayor of our beautiful and groundbreaking city and a great partner of ours, Brett Smiley.
Thank you, Colleen, and what an exciting day. This has been a long time coming with countless hours from so many people, so congratulations to everyone who poured so much time and effort into this. I want to acknowledge, and we don't want to keep shouting out the same people, but the reality is this took a lot of courage to get to this place. It took a lot of courage from a lot of people to do something that is groundbreaking, the first state-sanctioned overdose prevention center in the country. And Senator Miller is one of those courageous people. Representative Edwards is one of those courageous people. My friends and partners on the Providence City Council are courageous people for saying yes to Providence to host. And then all of the people who have known and loved someone and lost someone to the disease of addiction and in this crisis who have said there's got to be a better way. I want to acknowledge a couple members of the city team who are every day working better to serve our residents, Rachel Ferrara and Dennis Gonzalez. Thank you for your hard work. And Colleen, you mentioned him, but I want to give a special recognition also to EMS Chief Zach Kenyon. Chief Kenyon and the Providence Fire Department is, in many ways, on most days, the front line in Providence, at least. And they serve our community with compassion and understanding, and a progressive department that understands that the only way we're going to help someone find recovery is if we keep them alive. And sometimes that happens after the first overdose, sometimes that happens after the 40th overdose, sometimes not at all, but we keep trying. And my administration understands that, the fire department and their public safety partners understand that, and the Providence City Council understands that. Councilwoman Mary Kay Harris, who's going to speak next, I just want to take the opportunity to say thank you for sharing the very personal and compelling story with the press this morning that I hope, because it's hard to share those stories, but I hope that it serves as a way to help other members of our community understand what we're talking about here. And we're joined by Councilman Sanchez and Councilman Espinal, in addition to President Miller, Councilman Pichardo, because I will say, even though I'm very familiar with the recovery community, I'm a person in long-term recovery myself, I struggled with this concept, and I had questions. I think a lot of us have questions, and I think it's okay to say that out loud, that we had questions about whether this was the right thing to do, whether this made sense for Providence. But as Anna just said, as we learn more, we try to do better. And so I dug in, and I talked to researchers, and I listened to evidence-based studies, and I talked to people with lived experience, and I looked into the other places where this has been done, and then I too became convinced that we have an opportunity to do better and try something different here. And that's okay for the rest of our community who still has questions, to have those questions, but we want to answer them, and we want to tell them that these are not statistics, but these are in fact our neighbors. These are our loved ones. These are our parents and friends and kids. and we don't have a chance to serve them if we lose them. And so what's happening here, what will happen here, in addition to all of the other wraparound services, is to have a greater chance to serve one of our loved ones. And so the city was proud to designate $250,000 worth of its opioid settlement dollars to help make this center a reality. And we're going to continue to support it through its life here. But the Providence opioid and comprehensive addiction strategy extends beyond just this center. And so please know that we continue to invest in prevention programs, in recovery efforts, in harm reduction throughout the community, and many other ways with grants large and small to partners throughout the community who are helping us tackle the opioid crisis, but more broadly helping members of our community find recovery. Now more than ever, there's a lot of fear and uncertainty in our community, in our state, and in our country. And I want the residents of Providence to know, and of the broader community to know, that you are safe here in Providence. You will be respected for your choices, and we want you to know that our values have not changed, and that we will continue to stand up for our values, and that includes seeing dignity in every life and doing everything we can to keep them alive, so that we can help people find through their own choices their best life, and to support them in that journey. So thank you and congratulations.
Next, I'm so happy to welcome our councilwoman, a proud community champion, Councilwoman Deputy Majority Leader Mary Kay Harris.
What a great day, everyone. What a great day. I'm going to have you clap one more time to take the attention off me. Hello, everyone. I want you to know that I'm the city council for this ward. My name is Mary Kay Harris. I represent this ward with pride and dignity, I have to say. I want to say that here in Providence, right now and today, we all are excited. You heard from some of the people in the program already. We all are excited today for the ribbon cutting of Project Weber Renew Overdose Prevention Center. First of all, the first of the kind in the country. That's amazing. That's amazing. I also want to recognize in the room, we've heard from my executive, the top in the Providence right now, our Mayor Brett Smiley. You've heard some amazing words, how safe it is for us to be here in Providence and to work together as a team and to stay together. Those were amazing words. Those were things that we need to take home, take in our hearts, and keep forever. I also want to recognize my colleagues in government today. I'm going to start with my city body because of the fact that I work with them every day. Amazing people, amazing people. I'm going to start with Council President Miller, Pro Temp Machado, Majority Leader Espinal, and Majority Whip Sanchez. Amazing people. We also have the staff here as well from the City Council to show you how much they care about this project as well. We also have for my state rep, Josh Miller, and also Senator Edwards. Thank you so much for being here. I want to start out by saying to all of you, almost everyone knows somebody in their family, whether it's in your church, whether it's your group, whether it's your house, whether it's your neighborhood, or your workplace. Am I making this up? How many people know people that have had some type of addiction? We all have faced that one way or the other, or we've heard of it. Regardless of where you live, I want you to know that. No matter how old you are, or what the color of your skin, or how much money you have, or what position you have, this is a serious, serious crisis. And so, regardless of no matter what, no one is exempt. I want you to know that. I want you to take that home today. No one is exempt. In Rhode Island, we've had a record-shattering number, and I'm going back to 2022. I'm not even talking about where we are today. I'm looking to understand what the numbers could be today. But people are, 404 people died of overdose. What are we doing here right now? Day after day, month after month, year after year. Whatever we're doing is not enough. It really isn't. Or we wouldn't have these numbers that's dated even back to 2022. If a person is not alive, there's no way a person can change their life because they're not alive. There's no way. The situation calls for bold action. Some people need methadone, some people need counseling, and some people need someone to watch over them while they're using. You heard me. Some people need someone to watch over them while they're using. At this center, I'm gonna tell you something, you heard it earlier. Folks can get tested for HIV, hepatitis, C testing, receive supplies for safe drug use, syringes, disposal, drug checking tools. Medical staff will treat wounds from injection drugs and help manage hepatitis C. That's amazing, where people can come and get help. But what this place really about allowing staff to make connections with users. You understand? They're connecting with people. They're building trust. Trust enough that people will come back through this door. That's amazing to think about. When, like some of you, I'm gonna begin by saying I was skeptical in the beginning, but time again, the staff at Weber Renew showed their commitment to our community, and Special Ward 11, answering residents' questions, and helping clean up needles and trash in one of the most state-of-the-art park that I have on Dudley Street, close by. In the City Council, our city body responded in kind, unanimously passing a resolution authorizing Project Weber Renew to open and operate this center. So I want to thank the councils and the mayor all over again. We are here today. For those who say, I don't want to pay for this, I don't want this in my neighborhood, funding came from $2 million settlement from a lawsuit against prescription opioid manufacturers without the use of state or federal funds. I don't know where we're going from here, but that's where we started. That's where we started. This center is next to Rhode Island Hospital campus. Look at this, right next to where people, stigma of who people are, as you see them passing out on the street, who they are, the stigma, it's medical. It's a medical problem. It really is. It's a medical problem. So what better establishment that you guys have been able to claim here? When people at this center, I believe folks can stay alive, and I believe they can get their help, and I believe truly that they really can recover from addiction right here out of the center. I believe that. And I believe they will be treated with dignity and not shame. Now I'm gonna tell you something that's very personal for me. I lost my granddaughter, Imani Cheney, to a fentanyl overdose in March of 2024. I would have been so grateful, my family and I would have been so grateful that the center had been around when my granddaughter was alive. Here she would have known that battling addiction doesn't have the feel of shamefulness. Here she would have been treated with dignity, I believe, and gotten the help so many of our community need. So I want to say thank you for being here today. I have a friend with me in the audience, Angelo Adams, who said, people are gonna use anyways. They're gonna use anyways. So please have some compassion. Thank you so much for listening to me today. Thank you.
Thank you so much, Councilwoman Harris. Next, I'm so grateful to welcome our dedicated partner in this effort, a voice of the community, the Director of the Governor's Overdose Task Force, Cathy Schultz.
Thank you, everybody. So my talking points, I can't even read them because everybody said everything that needs to be said. I want to start off with this. Rhode Island is the first state in the country to have a state-regulated overdose prevention center. And I want you all to give yourself a round of applause. You know, I joke sometimes, but I mean it, sort of, that, you know, I came into state government, and remember, let me start with this. Most everybody here at one point or another has probably done outreach with me, has been arm to arm, maybe in the car, maybe walking down Kennedy Plaza, passing out naloxone. And I want to just kind of really focus on our pioneers. Back in 2014, there were a bunch of people who laid on the state house grounds because we were losing people. Right, Michelle? We were losing people. People were dying. And it is on the backs of those folks that came up and shared their stories over and over and over, that testified at the General Assembly in support of this bill, as well as many other things, whether it be the Good Samaritan law. That's where it started. And I'm going to share a little personal story with you all, because I honestly, I have to just speak from the heart. Everybody knows that that's what I do. I don't even know what year it was before I came into recovery. I lost my best friend to an overdose. She was 26 years old with 3 kids. The Good Samaritan law had expired, and that's why she's not here with us. She's not here with us because naloxone was not available. She's not here with us because people were afraid of law enforcement and they were afraid of getting arrested. So she was dragged out into the hallway. That's a very true story. And she died. Today marks the day where we're going to change that. We're going to change that narrative. We have been working so hard to change that narrative, but now here we are with an overdose prevention center. And Councilwoman Mary Kay said it perfectly. People are going to use, but guess what? They don't deserve to die. This is a preventable disease, and this is the first step in moving forward, so that we can make sure we keep people safe. And I think the most important thing is there's showers. Who doesn't want showers? That's it.
Cathy always keeps it real, she knows. I am overjoyed to welcome a longtime staffer of ours who has grown and contributed so much in the years that he has worked for us, and someone who makes us proud every single day, Mr. Evan Timbo.
Hello, everyone. Hello. I see so many familiar faces in the same room, all family and friends, and I feel safe. I feel like I'm in a good place. Thank you all for being here today. My name is Evan Timbo, and I'm an overdose prevention specialist here at Project Weber Renew. I am so proud to be standing in the Overdose Prevention Center with you all today. I would like to tell you a little bit about myself and how far I've come on this journey. I understand what it feels like to be on the other side of humanity. The struggle, the system barriers, poverty, being in survival mode every day. All those experiences led me to meeting Claire 6 years ago. She helped me to realize that in this field, There were other people doing the same work, drawn from similar experiences. And that one day I could do the same. She showed me the power of being a peer, and that I too could be a role model for others going through similar struggles. Meeting her helped me realize what we all can do in the future for our community. Today, she is the manager of the Overdose Prevention Center. Claire, could you move your hand? I worked at so many different roles in this organization, from a volunteer as a kit maker, to getting on the outreach team, to becoming an HIV and Hep C case manager. Now I stand here as an overdose prevention specialist. My hopes in working this role is that everyone who walks through the doors feels love, comfort, and safety. I look forward to coming in with my team every day and saving lives. Thank you.
Finally, I am so proud to introduce our powerhouse deputy director, a woman who truly needs no introduction, someone that I'm very proud to call a colleague, a friend, and an inspiration, Ashley Perry. Oh, good afternoon, everybody. We are finally here. Today should really be a celebration because today we are not just making history, but we are really breaking generational chains of trauma caused by preventable overdoses. We are telling the country that here in Little Rhode Island, the lives of those suffering with addiction do matter. I am so proud of our city today and even prouder of my Southside community. I grew up here on the South Side, just a few streets from where we are today, where some people called our low-income homes Clown Town, and what news outlets called us the epicenter for the war on drugs. From a young age, I saw that the war on drugs was always a war on communities. I saw families ripped apart by the legal system, including my own, and we were terrorized and vilified for our biggest crime of being poor. I am so proud to be here today and play a very small part in the true story of this neighborhood, which is one of strength and resilience. One that is playing its role to uproot the war on drugs. Our building here will not just prevent overdose deaths, but it represents hope, justice, that our community deserves health and love instead of punishment and shame. Our collective grief has brought us here to this moment. So while we celebrate today, we also have to honor the lives of our stolen fathers, our murdered mothers, and our gone too soon sisters and brothers. We remember our fellow harm reductionists, Tatiana Jones and Anthony Jenkins. We remember Christina Ramsey and Mark Benz, whose deaths showed us that even the most skilled harm reductionists can fall victim to a fatal overdose. Their souls will not just live on in our hearts, but live on in this space. And can we please take a moment of silence for all the people that we've lost that brought us here to this moment. Thank you. I have to start by thanking Colleen. Colleen, I could truly never thank you enough for all the opportunities that you have given me, for betting your entire career on people like me. People that are normally the throwaways, the outcasts and the outliers. You believed in all of us, even when we couldn't believe in ourselves. The work you have created here is so much more than just work. It has made us better humans and taught us to love unconditionally. And I hope that you know that your work that you first started from your heart will live on in our hearts for generations. Please give us. I'd also like to thank my friend and co-director, Dennis Baylor, and our director of strategy, Anna Jane Yokin.
The four of us have been working on this for 3 years. We are the OG OPC team. And it has been nothing short of a crazy ride. On this ride, our morals and our values have been tested over and over while carrying the harsh reality of the overdose death tolls rising. But the commitment that we have to saving lives, our mission to peer leadership, our values of upholding the principles of harm reduction, and our commitment to the people that we have served have always remained. And I know that this crazy ride is just getting started, but I could not have imagined of doing this without you three. I would like to sincerely thank the rest of our Overdose Prevention Center team leadership, our amazing medical directors, Dr. Miriam Harris and Dr. Justin Burke. You all truly make a perfect team and have really exceeded all of my expectations of what this would look like. I have always said that good doctors say they use their good doctor power to do good. But exceptional doctors like yourselves give that power back to the people who need it most. Thank you both. Our amazing OPC manager, Claire, who in the short time that we've worked together have accomplished tremendous things. I look forward to continuing to breaking glass ceilings with you. And I know that the love that you have for our community will radiate through this room, and I am so blessed to know and to love you. And to be honest with you all, I think I'm crying so much because in this journey, it's hard not to reflect, right? I see so many people in this room who have made huge impacts in my life, and I will ever be grateful for that. But the truth is that when I first heard that we were trying to make this a law, I was like, that's insane. The government's never gonna let us do what we know it's best for ourselves. So I can't let this day go by without thanking the original Super PAC. Again, my friend Anna Jane, Haley McKee, and Lisa Peterson, who when they first told me this idea, again, I thought it was insane, but you all should be proud because we are here today. And last, but definitely not least, and in fact, the most important people that I have to thank today is my amazing Project Weber and team. There will never be enough words to describe the amazing, devoted, badass team that I am beyond honored to lead. All of this is possible because of you all. So at this time, I would like to call you all up here to make history again by cutting this ribbon with us. My boss needs No, pick up that down. Okay. Let's hold it up, Mavis. Get their shot.
You work for it.
Oh, yeah, that is. You gotta. Nope.